Thank you, everybody, for all these questions so far. It's been really great. This next one is going to be specifically for Chris. So we were wondering, did you ever consider going into another field of medicine, and what influenced your decision finally to pursue vascular?
That's actually a very good question. So the answer to that is yes. I think everyone at some point you make a decision whether to do surgery or not. I actually considered other procedural fields and actually even considered a non-procedural field like neurology as I was going through medical school. What drew me to vascular were multiple opportunities, as has already been said, to do interventional type work, but also do open surgeries. But for me, there was also the added aspect of being able to engage in really fundamental basic science research. And so what I did as a medical student was I went to different conferences. So if I had a field that I was interested in, I would go to their national conference. And I remember going to the Society for Vascular Surgery annual meeting, and it was in Boston that year that I went. And I just walked amongst the posters because I was just asking myself, what sort of projects are the residents doing? What are the questions that are being answered? What's the patient population in this field? And every time I walked along amongst the posters and spoke to the presenters, it just reaffirmed that this was the field for me. There were people who were doing practice changing in clinical work. There are people who are doing disparities type work. I saw that the patient population in vascular ranges from people who are very rich to people who are very poor. And the disease process that what we see ranges from, vein diseases to people who are super sick and need big operations. And so I think for me, that was a huge tie. But in particular, in my situation, I was also looking for a field that would embrace me as a basic scientist in surgery. And vascular surgery kind of checked all those boxes for me. So I think having a field that checks the box of clinical expertise, patient population that you will work with, and then whatever other niche thing that you're interested in. For me, it was research. If you're just education or innovations, whatever, just to find a field that will welcome you and for which you would feel like family. I think that's important. And it's been a great ride so far. I'm PGY 6 out of 7, so I've got another year and a half to go.